Top story this half hour, Omicron variant of COVID has been detected now in the Ocean State. The governor expected to announce new plans to try to deal with the virus this week. 12 News reporter Kayla Fish joining us live with what we know right now and what we are expecting to hear from the governor today. Kayla.
Hey, good morning, Patrick. Well, in announcing the state's first case of the Omicron variant over the weekend, Governor Dan McKee said that it was fully expected that the variant would eventually be detected here. He says this is not a cause for panic and that Rhode Island is prepared. And we expect to learn more about those preparations sometime this week, when the governor plans to announce the state's strategy to address an increase in COVID cases. We're told the governor's plan will focus on vaccinations, testing, masking, and staffing capacity. Now, according to the Department of Health, a Providence County resident in their 20s tested positive for Omicron after a recent trip to New York. That person was fully vaccinated but had not gotten a booster shot. And getting a booster, according to Dr. Ashish Jha, will likely help in containing the new variant. Dr. Jha, who leads Brown University's School of Public Health, weighed in on the spread of Omicron last night on social media, saying it's safe to assume it's in every state. He says key questions about its rate of spread and the damage it can cause remain unanswered. But what is clear is that he says, quote, a booster will likely help a lot in preventing infection and reducing further spread. He also says those who are vaccinated but not yet boosted, or those who have recently recovered from infection, will have protection from severe illness, adding that breakthrough cases will be common but considered mild. And as we wait to learn more about Rhode Island's strategy to deal with an uptick in cases, we're also hearing more about another New England state and how it is preparing and handling an uptick in cases there. We'll have more on that coming up in the next half hour. For now, live in Providence this morning, I'm Kayla Fish, 12 News.
Very soon, the governor will be rolling out a comprehensive plan to deal with an uptick in COVID cases. The updated strategy comes shortly after Rhode Island announced its first case of the Omicron variant over the weekend. Kayla Fish live in Providence right now with a closer look at what that plan might include. Kayla.
Hey, good morning, Patrick. Contact tracing for the state's first case of the Omicron variant is continuing this morning. And as Rhode Island health leaders work to determine its potential spread, the governor and Department of Health are focusing on making sure the state is prepared. This week, we're told that the governor plans to announce a comprehensive plan to address an increase in cases. That strategy, we're told, will focus on alleviating pressures on the hospital system, keeping schools open for in-person learning, and preventing economic disruptions. Now, Rhode Island reported its first case of Omicron over the weekend, and it's also been detected in neighboring states. In the meantime, in New Hampshire, COVID cases have jumped 25% in the last 2 weeks, and the governor has asked the National Guard and FEMA for help there.
Ultimately, as winter comes, the seasonality, if you will, of this virus is really taking precedent. But we're prepared, and we're trying a lot of different innovative things to flex the bed space and whatnot within the hospital system. It's really important that the healthcare system is preserved.
Now, here in Rhode Island, Governor Dan McKee has extended the state of emergency to deal with COVID. He's also extended the masking requirement for all public schools. Those will both be in place into the new year. And again, we're expected to learn the state's updated strategy to deal with Omicron and an uptick in COVID cases sometime this week. And as soon as we learn more information, we'll pass it right along to you. We're live in Providence this morning. I'm Kayla Fish, 12 News.